This article was published in 2022 in Journal of Cosmetic Dermatology. The title is Ultrasonographic Analysis of CrossFit and a Novel Guideline for Botulinum Toxin Injection. We know that the practice of examining pregnant women using ultrasound was an early development of clinical ultrasonography. Its ability to provide real-time is applying to the aesthetics procedure nowadays. So, we propose a novel injection method based on the anatomical information and dynamic features by ultrasonography. The noticeable crossfit is among the common factors for facial aging. The term crossfit refers to the appearance of remarkable bilateral orbital wrinkles caused by orbicularis ocular muscle. An effective treatment is the flaccid paralysis of the orbicularis ocular muscle. The botulinum toxin is one of the representative treatments targeting muscle and have been extensively used for CrossFit. Previous study recommended injection point at 1.5 to 2 cm lateral to the lateral canthus along the orbital rim arc, and above and below this point along the orbital rim arc. And the multi-point and multi-level injection techniques was to achieve a zone treatment. Although extensive injection guides have been carried out on botulinum toxin treatment, much of them are performed with naked eye, and a few studies have investigated about the dynamic analysis for the crossfit formation, including the detailed anatomy under the ultrasonography. During the formation of the crossfit, the movement of the muscle position and thickness can be observed by ultrasonography. The aim of this study was to propose a more effective and reliable injection method for the crossfit by assessing the muscle position and thickness. For the orbicularis ocular muscle, ultrasound images from 20 volunteers were included in this study. The volunteers was placed in a semi-supine position for the examination. Volunteers were asked to make a relaxed and smile expression with squinting eyes hard to maximize the visualization of crossfit. We can obtain the movement of the orbicularis ocular muscle during the formation of crossfit by observing and comparing the ultrasound images between the relaxation and contraction. And the horizontal line was drawn laterally from the lateral canthus, and landmarks were marked where this line intersected with the orbital rim and the lateral margin of the frontal process of zygomatic bone, point B. And point A refers to the midpoint of orbital rim and point B, and point C is 5 mm lateral to point B. Ultrasonographic examination was performed at this horizontal line. The depth of the orbicularis ocular muscle from the skin surface and the thickness of the muscle were measured using ImageG program, and descriptive statistics were used to describe the distribution of orbicularis ocular muscle. At the lateral canthus level, the mean length between the lateral margin of the frontal process of zygomatic bone and the most margin of the orbicularis ocular muscle was 12.5 with standard deviation of 1.3 mm. The depth and thickness of the muscle was described in this figure. The lateral portion of the orbicularis ocular muscle, located at lateral point B, was clearly demonstrated to be the thickest. By comparing two pictures, we found that the contraction of the orbital portion of the orbicularis ocular muscle moved the skin toward the lateral canthus, causing fine wrinkles in the skin. Under ultrasonography in the horizontal view, it was also observed that the lateral portion of the orbicularis ocular muscle contracted during medial movement as the crossfit formed. So, closer inspection of the dynamic ultrasound images show that the thicker lateral portion of the orbicularis ocular muscle lateral to the point B played a major role in the formation of crossfit. Due to the anatomical location of the most lateral margin of the orbicularis ocular muscle, about 12.5 mm lateral to point B at the lateral canthus, additional botulinum toxin injection should be administered at a point 5 to 10 mm lateral to point B. Therefore, based on our results, we propose a more effective novel botulinum neurotoxin injection for improving crow's feet. Compared to conventional injection guideline, the novel injection guideline included additional injection at points 5 mm lateral to the point B. This is two-line novel injection technique comprised injections along two curved reference lines, passing points 15 mm lateral to the lateral canthus, which is conventional injection, and 5 mm lateral to point B, which approximately 30 mm lateral to the lateral canthus, is the additional injection. And we knew that intramuscular injection no longer being the only injection method for botulinum neurotoxin administration. Consequently, we administered the injection intradermally into the relatively thin portion that was not easy to target the muscle. Simultaneously, we administered the intramuscular injection into the portion of the thicker orbicularis occlusive muscle with an abundant subcutaneous layer at the additional points. A note of caution is warranted here, as this study is unable to encompass the entire wrinkle patterns and the anatomical relationship due to the high customization of the detailed facial muscle structure. So individualized injection techniques may be applied based on the patterns of the crow's feet. A note of caution is not to give deep injections and large dose into the lateral and the lower part with the zygomaticus major muscle. It may cause the mouth corner cannot be elevated due to the weakness of zygomaticus major muscle. In addition, we should consider anatomical variations such as type C lateral muscular band of orbicularis occlusive muscle that originate from the lateral orbicularis occlusive muscle and insert into the mouth angle. When botulinum neurotoxin is injected at the most lateral portion of the orbicularis occlusive muscle, in cases of type C pattern, it may result in asymmetric smell due to the weakness of the lateral muscular band of orbicularis occlusive muscle. To reduce these side effects, the facial expressions of various patients must be evaluated before the procedure. Thank you.